Hi guys, I wanted to talk about the different types of pain to describe to your doctors and some of the things that I've tried in the past to help with pain management. Rheumatoid arthritis can affect any organ and joint in your body. And I have had in the past issues where it has caused my eyeballs to become inflamed. You think about the pressure in your eyeballs. My pressure had increased. My eyeballs actually measured larger than normal. And that was somewhat uncomfortable. It wasn't necessarily painful, but it was uncomfortable. I have had nodules in my lungs, which we were very thankful that it didn't turn out to be cancer. It also did not turn out to be sarcoidosis, which is another autoimmune disease in which tumors in the lungs are very that's kind of the whole disease, is it causes tumors in the lungs. It was excuse me, turned out to be just an infection of some sort that my doctors think I just picked up somewhere, and it settled in my lungs, and it took me about a year for my body to heal from that, because my immune system had been suppressed. It didn't have the capability of fighting this infection off in, a short amount of time like your immune system might have. Had to have a lung biopsy done, which is no fun. They inserted a needle in between two of my ribs and went into my lung and took the biopsy. And yeah, that's not a good way to spend a day. Yeah. Let's see, what else has it affected? Obviously joints. It's affected my joints. And mostly the pain that's been associated with my RA has been a constant, it's chronic pain. So it's not like it's for when you're not in remission and you're having a flare or your disease is active. The pain is constant. It doesn't go away. You might be able to take pain medication and can lessen it, but it never really goes away. So if you think about in a 24-hour period, the only time I consciously am not feeling pain is when I'm asleep. And so that's really the only downtime that I get from having pain. A lot of times the pain is a dull, aching pain. And so here's where I want to talk about the differences. So right now in my wrist and my knuckles, this is all swollen in both hands. I don't know if you can tell that I have inflammation. So like my knuckles aren't very indented. It's kind of like even. So that means that the space in between the knuckles is swollen. And my fingers look like little sausages too. So when I'm just sitting here like this, it's not a sharp stabbing pain. It's more of a dull, constant aching pain. If I were to bend my wrist or move my hand in a certain way, then it will create a sharp stabbing pain. And obviously you try to avoid doing that movement again so you don't have that sharp stabbing pain. There also in what's related to the joint pain is you can have pain that radiates out into your muscles and your tendons. So it's important to talk to your doctor and say, okay, this is a dull pain, this is a sharp pain. It feels like it's tendon pain or muscle pain. And when I first had rheumatoid arthritis, I just thought, like, if my knee hurt, then the whole thing was joint pain. When in actuality, you may have, like, radiating pain in your tendon. So maybe not at the joint specific, but away from the joint is hurting. That may be the inflammation in your joint is stressing the tendon or the muscle that's just off of that joint. So it's important to be able to try to discern between, am I having pain in the joint? Am I also having pain that's affecting the muscle and the tendons? What I find, and so I try to communicate that with my rheumatologist, and just over the years, having experienced these different types of pain, it's become easier for me to talk to him about. When my eyes were inflamed, it was more of a pressure. I could feel my eyeballs. If you think about it, you can't really feel your eyeballs. But because the pressure was pressing up against the eye socket and the nerves, so I could feel that pressure. It wasn't a sharp pain or anything like that, but it was just a weird pain, I guess. So there are different things that I can take to help the different types of pain. I have a CBD oil spray that I use on my sore spots, and it helps mostly the more superficial pain. So this is going to help more of like any tendon or muscular pain. And the lidocaine patches also helps in the same way. So the lidocaine patches these are topical analgesics, and the lidocaine basically numbs the area. So it numbs the skin, it numbs the tendons and the muscles. And the CBD spray oil that I have is kind of the same way. It just affects the top of your skin. It doesn't actually go down into the joint. So I find when I have, if my knees are sore, like above the knee or below the actual knee joint, that's most likely tendonitis, tendon pain or muscle pain from inflammation that's actually in my knee. And the lidocaine patches or the CBD oil spray works, is more effective on those more superficial type areas. In order to get relief from the actual joint pain, I need to take something a little bit stronger that's going to affect how my body perceives pain. And the main drug that we can take, if over the counter, if you take anti-inflammatories, you can take ibuprofen. I take a prescription strength of ibuprofen. It's called meloxicam. And Tylenol is over the counter, and that helps with inflammation. If you go into the prescription drugs, most commonly prescribed is tramadol. And what tramadol does is it releases serotonin in your brain. So serotonin is one of the feel-good chemicals in your brain. And like 20 minutes after I take a dose of tramadol, I can kind of, like, I noticed that maybe I feel better. You can kind of get that sensation of, hey, I kind of feel better. And the way it kind of works on pain is, let's say your pain level is here, and the amount of serotonin that your dose of tramadol might release from your brain is here. So there's more serotonin than there is pain at that point. And so it will take the edge off of this pain. If the pain isn't that great, it might actually take away that pain for a period of time. And tramadol you can take every 4 hours. So you think you might have this situation for 4 hours at a time. However, if your pain level is up here and the amount of serotonin that is released from the tramadol dose still only goes up to here, you have a surplus of pain. And what the tramadol will do is it's still releasing the serotonin, but the amount is enough to only really take the edge off of this pain. So you've still got that gap there in the pain. I have tried other medications, some narcotic medications, and this was really kind of before, the whole opioid thing. My physician does not prescribe opioids, and so he just made a personal decision that that's not something that he was willing to continue to do. So, but prior to that, I had tried hydrocodone, which is Vicodin, and I'm not sure how Vicodin works on your pain receptors, whether it blocks the pain receptors or it keeps your brain from communicating that there is a pain somewhere. I'm not sure how it works. Vicodin did not work on my joint pain. It just made me sleepy. My dad used to take Vicodin, and it worked for him for whatever pain that he had, but it didn't seem to help with the actual joint pain. The first medication that I ever tried was Darvocet, and this is like back in the day when Darvocet was still on the market, and Darvocet worked really, really well. And I was actually able to manage, function normally. It didn't affect me in a way that I was, groggy, druggy, when you feel medicated, I mean. And so Darvocet worked really well. And again, I'm not sure how Darvocet worked with the pain receptors. I really, frankly, didn't care how it worked. But it did. And unfortunately, it was taken off the market because it had consequences. Some of the consequences of Darvocet were problems with your heart health, and so the FDA pulled it. I took a kind of a cousin to Darvocet, and that was Percocet, and Percocet is still available on the market. It's oxycodone, I believe, is the generic name of it, and that works just as well as the Darvocet did. And Percocet is a combination of the oxycodone and acetaminophen, so basically Tylenol. So you put the combination of oxycodone and Tylenol together and you have a Percocet. Unfortunately, I'm not able to get that medication because it's a narcotic and my physician doesn't prescribe narcotics. So back in the day, I had some Percocet, and I've been basically rationing that supply. For 5 years I've been rationing a supply, and I have to kind of justify if I've taken Tylenol and the Tylenol hasn't cut the pain, and I've been taken tramadol and the tramadol's brought me up to here, and at this level my pain level, let's say, is an 8 or 9, and I'm absolutely going crazy and I just can't take it anymore. It's only at that point that I can justify dipping into that stash, knowing that I'm not going to be able to replenish it. So I will take 1/4 of one pill, and that's how little I take to get relief. But the difference has to be just here I'm going bananas, like I just can't take it anymore, and that's when I have to dip into that stash. Unfortunately, I think there are a lot of people who have become addicted to these types of medications because chronic pain is just that. It's chronic. It's never going to go away. It's not acute. So acute means it's going to last for a certain period of time and then it will stop. And chronic is perpetual. And so if you try to take Percocet or Vicodin or things like that in perpetuity, you're going to become addicted to it. And so I understand why those medications are typically not prescribed for chronic pain sufferers. They're more prescribed for if you have a surgery and you're given, a 2-week recovery time. So that's more when those types of medications are prescribed. So I do utilize, like I said, the lidocaine patches, CBD oil spray that I have. Those are more for the topical, for the muscular pain, the tendon pain. I also have what's called a TENS unit, TENS, and it is where you have these little electrodes that you stick on, and there's a monitor, and you turn it on, and it will send electric pulses into that area of your body. And what that does is it stimulates blood flow and circulation into that area that then helps cut the pain back. And so I've used the TENS unit a lot on muscular pain, and again, it's temporary, but it does help relieve it. So those are the things that I've used in the past, and that some of them I'm still currently using. I will put a picture of the pain scale that I use in this video at the end of this video, so you can take a look at it. It's really good because not only does it describe, it gives you like the little, like a 0 is a happy face and a 10 is like the most miserable face you've ever seen. And so it gives you kind of a description of the faces, but it also gives you a description of how the pain is affecting your daily life. Does it interfere with your thought? Does it prevent you from doing things? Can you not get out of bed? So just the differing levels of increased interruption that the pain causes you is described on this pain scale. And so I find it a very good pain scale, and I can't remember the name of it. I'll try to put it in the comments if I can find the name of the pain scale. It actually has a name. So I also will do ice packs or moist heat wraps and Epsom salt baths, and so those are really pretty benign remedies. Again, they're temporary, and by temporary I mean they might be a half hour of relief, or 20 minutes or 40 minutes of relief. So a more long-term pain relief would be like the 4 hours type thing. So let me know if you have any questions, and I'll try to answer them as best I can. Take care of yourself, stay healthy, don't get COVID-19, wash your hands, and be well. Love you guys. Bye.